Howdy, everyone. I'm excited to get out of Aggieland for a few days and see fighting Texas Aggies beat the hell out of Arkansas tomorrow. So this is just a great way to start and tell you a little bit about the work that we do at the Texas A&M School of Public Health. A lot of people don't know we have a School of Public Health, and so we're going around introducing the work that we do and why it's important to all Texans, even folks that are up here in Fort Worth. So the mission of our school is stronger communities, healthier people, our tradition. And really, you know, when you look at the vision, it's how do we make communities healthy? And if we saw the video, the idea behind public health is it's everything in the world that keeps us healthy outside of the clinical aspect. So everybody knows what a doctor and a nurse and a pharmacist and a dentist does, and you see them one-on-one in a clinical thing. Public health is everything else that keeps us healthy. So when clean water comes out of your tap, when you don't get food poisoning from your $27 lunch, when we have smoke-free policies that don't mean you get free cigarettes, those are all public health. And so it's really how do we keep populations healthy, and that's what we're going to talk about today. We are one of the top 25 schools of public health in the country. We're going to be celebrating our 20th year this next year. Our MPH has actually increased, is now number 16 overall in the country out of 120 MPH programs. So we really are one of the best schools of public health, especially among public universities. So we're really excited and proud of the work that we've done. We have 4 departments that really talk about the different types. When you look at public health, it really truly is a transdisciplinary field. And so we have a department of health policy and management, and we train a lot of people that become into health administration. They'll run hospitals. And then we have epidemiology and biostatistics, and this is really these are the number folks, right? And people are looking at outbreaks and where we see disease trends coming through the globe. Health promotion, community health science is really helping people keep healthy lifestyles, and environmental occupational health, where we look at air and water quality and also workplace safety. We spend a lot of time training folks that work in the oil and gas industry and other industries to make sure people are not getting hurt at work, because that's such an important part of public health. We have 2 campuses. We have one in College Station, so we're right on the main campus in College Station, and then we also have one that's been around now for over 16 years in McAllen. So there's been a lot of news about how Texas A&M is moving to McAllen. I keep telling him, Chad, we've been there for quite a while. But we're actually going to be moving and joining the new North McAllen campus as that opens in the next year. So we're real excited for new facilities there. And really to deal with a lot of issues, we'll talk about Zika in a minute, but there's a lot of health issues that come up across the border. And so that the closer we can be to the border, the faster we can stop disease spread through the rest of Texas and the U.S. We have an amazing student body. We have about 450 graduate students. We have 350 undergraduate students, and as you might know, anyone that went to Texas A&M, that picture probably does not look like your class looked when you went to A&M. We have 67% of our students coming from underrepresented minority backgrounds. It's really a very different school, including 40% of our incoming freshman class is Hispanic this year. So we're really drawing from across Texas. Our demographics look much more like the state of Texas than most of higher education, and we're really proud that we're able to recruit throughout. As I mentioned, undergrad is brand new, and this is interesting. When I went through school, I didn't know what the heck public health was, and I fell into it and landed into it. I'm a psychologist, you know, so everybody knows what psychology. You went to school, psychology is everywhere, right? But public health, no one knew what it was because it was graduate only until a couple of years ago. So we started the Bachelor of Science in Public Health in 2015, and we hit 355 majors in 3 years. We're going to have 1,000 to 2,000 majors within 5 years. We are just delighted about the growth of this. We are getting absolutely incredible students coming in, and it really is going to be a difference maker, I think, for the state. So what do we do? Well, I'm sure everybody is familiar with Hurricane Harvey. You know, we're just down the road about 90 miles outside of Houston, and obviously something that we're very, very concerned about. And how does public health, if you look at disasters, most of the loss of life occurs post-event, right? We get excited, the news cameras are all there when the rain is coming down, but people die after the event ends. And so we look at post-disaster as public health emergencies. Why? Infectious disease spread. And I'm spending more time on Zika, but If you would like to breed mosquitoes, large pots of standing water would be a great way to do it. That's what we have all over Houston. We have breeding grounds up and down the Gulf Coast now for massive amounts of disease-spreading mosquitoes. It's one of the most dangerous animals in the world. If you are scared of sharks and tigers and anything else, 1 million people die annually from mosquitoes. Superfund contaminants. So we have funding. We had been doing this, going throughout Houston, looking at some of the sites that are Superfund. If you would like to spread Superfund, how about flooding the site where the contaminants were into the neighborhoods that surround it? So you might be going back and you're thinking, mold, of course, mold is really important, right? And we can see mold in our houses, but we can't see the contaminants and the heavy metals that came out of the Superfund sites. So people are going back to their houses now, they're trying to remediate mold, but they have some of the worst chemical contaminants in their houses now. What do we do with that? We are there in the houses, taking samples, testing it, and letting folks know, hey, you can go back or you can't go back. Loss of dialysis and other healthcare. We're seeing this down in Port Aranis and some of the places outside of Metro Houston where their dialysis center get knocked out. Well, if you need dialysis, you need care, right? And so really, how do we make sure that care is provided, that we have ongoing continuity of care? So these are some of the major issues that we've been dealing with. We've been sending teams and students and faculty since Harvey came through to really work on this post-disaster public health emergency. What's really interesting is we actually were there ahead of time. We've been working in the community in Houston for the last 2 years around developing citizen scientists, so people in the community around their needs, and they came up and they said, we're most concerned with flooding and hurricanes. 6 months before Harvey came in, they're telling us this is their most important concern. I wish we had had 6 more months. We did a lot of good things, but we didn't have quite enough time. Okay, Zika. Zika's an interesting case, right? So who's scared of Zika right now? Not so much. If I was here 2 years ago, who would have been scared of Zika? Everybody, right? A lot of people. You know the thing about public health? The problem that we have in public health is when public health works, it's invisible, right? Everybody here that didn't get Zika, you celebrate that every morning, say, you know what, I didn't get Zika. No, you're not even thinking about it. If you got Zika, though, when we had a huge epidemic, you'd be thinking about it, because when public health fails, we think about it. When it's successful, when you don't get sick from your lunch, you don't think about it. But when you get food poisoning, you sure as heck do, right? And that's one of our big issues, is that we did great. If you look at it's spread through the infected Aedes aegypti mosquito. It's fever, rash, conjunctivitis, lasts several days a week. 80% of people don't know they're infected. It came right up from Brazil, right up through Latin America, into Mexico, and for the large part was stopped before it entered the US. That is because of the work that public health did. We sent students all across the border regions through the colonias, making sure folks were getting rid of standing water, that there were screens in people's windows, that people were not spreading these diseases. Do you think the mosquito knows the US border? I mean, maybe if we build a high enough wall, we can stop the mosquito. It needs to be about four stories. But they don't. Mosquitoes don't know borders. And so this is one of the big things, is that we cannot stop infectious disease unless we have really good public health abatement projects. I think we know most of the stuff around. I won't spend much time on this, but the problem with Zika is microencephaly in children. And if you get it as an adult, not so bad, but you get it when you're pregnant. But the thing is, we don't even know how long it stays in the body. So if a woman gets it 2 years before she's pregnant, is it clear? Is she not? We don't know yet. So there's a lot of research going on in this area. We're expecting we're going to get it at some point. I mean, this is not gone. We haven't cured Zika. We don't have a vaccine yet. So, public health is about vigilance. It's about making sure that we're there all the time. We have Aedes aegypti all across Texas. So the mosquito that carries the disease is here and can come, and we're going to keep fighting it, as long as we can. So what do? We have a program that I think this is just fantastic. One of our faculty members developed this. It's called EpiAssist. And when we look now, we talk about students, we talk about high impact learning, right? How do we get students in the field doing real work? And this program, what it does is it applies students out to local health departments for surge capacity. So when we got calls from Port Aranis, they said, we need students to come down and help us because we need to go door to door, we need to do assessments of what's happening, we need to do field epidemiology. We can do that for any health department in the state of Texas. and we do on a regular basis. So we send these students out, they help out, they get real world experience, so it's great for them, but it's also great, a lot of these rural communities, you might have 3 people in your health department. They don't have the ability when a disaster strikes to really be there and be in this kind of large built capacity. So huge advantage for students, it's great for them, and it's great for the partners because we're there in public health emergencies. When we can get students, and there's some cost. Houston's easy because I can drive them, but if it's western part of the state or even up here, it gets larger and longer. But great program. So what have we done? We've worked on flash flood warnings. We've worked on cyclospora in Travis County. When the West Texas fertilizer plant exploded, we did the injury surveillance for that. We're doing the Superfund sites from Harvey right now. We did some of the recovery after the Bastrop wildfires. We've been helping some of the communities in Waco look at some of their infectious disease outbreaks. So really been, mostly Central Texas, but wherever people need to be, we can send students. So, if we do ever have a disaster in the Metroplex, we will be here and we'll be helping out. Water to me is one of the scariest things for public health, and we have a whole lot of water right now, but the problem is we have the same amount of water in the world all the time, right? The problem is 2. It's distribution. We got way too much of it, a few weeks ago, and it's contamination, right? And so it's access to clean, fresh water distributed throughout. And so we know here in Texas, we went through drought, right? Now we just went through flood, but we went through drought. It's estimated that by 2025, 2/3 of the world's population is going to face severe water shortage. This is a huge problem. It's much worse than oil. Wars will be fought over water. So what are we doing for that? Got this faculty member, Brenda Sharma. He is amazing. He is, we call him the Iron Man because he does all this stuff with supercharged iron or ferrate, and it actually is an attractive particle contaminant. So you can put this supercharged ferrate into water. It draws all the particulate matter towards it, leaving clean, fresh water. So we've been looking at using that with solar energy. We can use it in military sites. If you look at why do most people die in military conflicts right now, it's supply chain stuff. So if you've got a forward base in Afghanistan, you've got to get to them with water, right? They might have a pool of water next to them, but it's contaminated. If we can disinfect that water, we can reduce the number of soldiers that die from IEDs on the road by making it easier to get water into or decontaminate water where we are. We look at obesity and diabetes. This is a huge problem for the state of Texas. We're paying $16 billion annually in costs related to obesity. Major problem, and it's a health problem. So we have funding from the state to do Healthy South Texas, which is in 27 South Texas counties. And I think this is one of the most genius ideas that I've seen. It's, we have the AgriLife program, right? And ag extension agents are awesome. They're well connected in the community. People love them. But the family and consumer science, the idea of doing, showing people how to sew and cook brownies has kind of went the way of the dodo, right? But we have these folks on board, and so we've looked at it and said, how do we reinvent ag extension, especially family and consumer sciences, for the next generation? And the idea is to train them as public health workers. So they are in every community, and they're able to respond and do this work throughout the state of Texas, especially in our rural communities. We have funding to look at the way we develop our neighborhoods. The old airport in Mueller and Austin has been redeveloped, and we're looking if people move to that community, are they more active, are they healthier? I know Fort Worth is a blue zone community, same type of idea, right? If we change it, do we actually see the changes in health outcomes in our populations? We are developing the workplaces and schools of the future. So we've been doing a bunch of work on standing desks, and if anybody has a standing desk, I have them. It keeps me, because I can't keep still very long. It's an amazing thing because your level of energy just stays up throughout the day. So we took them, we put them into a call center, right? You want hard data outcomes, and I can talk about health all day long, but when I can talk about the bottom line, that's when businesses listen, right? So we put them in call centers where people are calling folks on the phone, doing technical support. They increased the number of completed calls by 46% if they had a stand preferred desk. If I owned a business and I knew that I can complete my workforce by almost half, I'd be investing in stand desks. I mean, I don't care about the health. Well, I do care about the health. But if I didn't care about the health, I'd care about the productivity. Texting while driving. The state of Texas passed a state law banning texting while driving. It's pretty much like being drunk behind the wheel. One of our faculty, Alva Ferdinand, who is amazing, did states that had the law versus those that don't. It reduces 9% of hospitalizations among 22 to 64-year-olds if you have this policy. Less Texans will die now that we have a texting while driving policy. This, of course, saves the state money and saves lives. Improving healthcare delivery. We pay way too much for healthcare. Everybody knows that, right? We pay too much, we get too little. So we're trying to figure out what's the best approach to do this. We have a university industry-funded cooperative research center. We're the only one in the country that does this. It's funded from the National Science Foundation. We're the lead along with Penn State, Georgia Institute of Technology, Northeastern UAB, Florida Atlantic. With all these industry partners, they come to us with the questions they want to answer about improving healthcare. So it's industry-driven university research. And we think that's one of the best ways to find how do we improve the delivery of service. This has led to a new partnership. We just signed an MOU with Houston Methodist to collaborate on a joint Center for Health Outcomes Research. Methodist is interested in saying, how can we improve the quality of care that we provide? If one physician's doing something this way and we're doing it this way, which is the better way? How do we get better outcomes? How do we save money? How do we get people out so they're not coming back for readmissions? We are working with their data. I've embedded faculty in Methodist in Houston to do this type of work so we can provide better healthcare delivery. There's more than just, we don't need to read all that. Who does that? Aging population. We have a gray tsunami in the U.S. You know, we had all these baby boomers, now they're all getting over 65. This is going to cause health issues, right? This is going to cause a lot of different health issues that we haven't dealt with. We launched this past year the A&M Center for Population Health and Aging. What the center does, their main question is how do we keep senior citizens in the community and out of nursing homes? Anybody who has dealt with a parent, a grandparent, who has went to a nursing home knows that it is a terrible way to end your life. I mean, unfortunately, it's just really not a positive thing. The longer we can keep people in communities, active, living with their families, the better off everybody is. We have one of the signature programs, an evidence-based program on reducing falls. Falls are one of the biggest reasons people end up in nursing homes. When people go to nursing homes, they don't usually come back out. So if we can greatly reduce the number of people that fall in Texas, we can keep people out of nursing homes longer. It's better for the person, it's better for the family, it's better for the community. Global connections. One of the things that I've really been strong on is we need to work globally. We need to be able to understand other cultures. And I work a lot in China. And when we were working in China, a lot of stuff we were looking at is things like SARS. You've got 1 out of 5 people in the world is Chinese, right? Think about that. 1 out of 5 people in the world is Chinese. 1/3 of people are either Chinese or Indian. So if we think about any kind of disease spread, it's probably going to start in China or India. And if we don't understand these cultures, if our students can't work there, we are not going to know what's happening until it's here. So we've developed exchange agreements with several Chinese universities, South Korea, Ecuador, now in Austria. This way, my students can go throughout the world, be trained, so kids from Texas, local kids, have this experience globally so they know what's going on and they can recognize disease before it comes here. We had this with Ebola, right? Ebola came, no one had worked on it before. We have Zika coming up, no one had worked on it before. Things come to Texas. We have huge airports right here in DFW that's bringing in all sorts of diseases every day. If we're not ready to stop that, we've got a problem. Okay, last thing I'm going to talk about. So my work is obesity, and I came here from Hawaii and said, okay, let's see if that's a problem in Texas. Got this great little slide, yeah, that's not good. And so, Tale of Two States. Hawaii, we were #1 in health. We had a large program that I worked on for 15 years. We got ourselves from about 8 to #1 the last 5 years running. Smoking is not that much different from Texas. We're 33rd ranked in Texas, though. Not so good. Obesity is about 10% higher in Texas than it is in Hawaii. Low rates of cancer and cardiovascular disease in Hawaii, mid to high rate of cardiovascular in Texas. We don't spend any money on public health here. So I go to my kid's school, and they're doing this school fair thing. And you guys have seen the soda ring toss? I had never seen this before. You throw the ring over the bottle of soda. And I'm like, well, that's crazy. So what do you think they give the kids as a prize if they get it? And there are these kids, one in each hand, and they're guzzling them. And I'm like, oh my God, where am I? You know, that's not a good idea. That's not a good idea. So sugar-sweetened beverage, one of my things, right? So I write come to A&M. I'm the dean of the School of Public Health, right? So at least public health can do positive things. And I say, you know what? We're not going to give, I'm not going to use school money to buy sugary beverages. You can have unsweet tea, you can have water, you can bring your own if you want to. I don't care. I'm not spending my money on it. So then I get this email that says, it is imperative that we're able to provide beverages with added sugar. It's a courtesy to our potential industry partners. From one of my faculty members. I'm like, no, it is not. The industry partners are all in healthcare. We don't need to give them a Coke. We're working. It's like baby steps, We're getting there. We're getting there. So, then I blast, Texas, and they put it on the front page of the paper. I'm like, I am gonna have no friends here. Crazy Hawaiian guy who likes to wear Hawaiian shirts. I gotta put suits on and hide myself. But Hawaii, Hawaii's interesting. It's very different. So we banned smoking in all workplaces back in 2006 when I chaired the Coalition for Tobacco-Free Hawaii. So I'm glad Fort Worth is catching up a decade later. Raised taxes from $1.20 to $3.20. Then the legislature kind of took over. They banned smoking in all parks and beaches in 2015. Banned e-cigarettes along with that in 2015, or the same ban as regular cigarettes. And then they raised the smoking age to 21 in 2016. So Hawaii really, has embraced the idea of being the health state and really trying to change this. They have the fourth lowest high school smoking rate in the nation at 10%. Adults are the second lowest at 13%. In Kentucky, it's 26% of adults. So it's half of what the nation is. Anybody know what the lowest rate of smoking is in the country? What state? Yeah! That's the first time someone's got it right. It's full of Mormons. I kept trying to beat them, and we can't beat them. I tried religious conversion. That didn't seem to work. I don't know. Yeah. One more slide. I'm going to mess up on my last slide. There we go. So the last thing that we're doing, we are in the best athletic conference in the country. I like to say that in UT country. But the Southeastern Conference is 14 universities, but it's in 11 states that really fall in the bottom of the health ranking. So Mississippi, Louisiana, Alabama, all bottom of the health ranking, the least healthy states in America. So back in April, along with the Aspen Institute, we pulled together the SEC. We have a President's Declaration. We're working with Extension, CEO Gold Standard for Cancer Prevention, partnering with historically black colleges, universities, really on this idea of creating a culture of health. Is how do we mobilize the SEC to be a conference not just of football but also of health. And for any of you who are affiliated with other universities, if you want to challenge us, we would be happy to take on the Big 12 or any of the other conferences because we think we're the best. But thank you very much. Our job is to save lives, prevent disease here in Texas.